Please go ahead.
A very good morning to one and all. I'll be presenting on the role of cell components in the differentiation of amniotic membrane epithelial cells to limbal epithelial cells. Limbal stem cell deficiency, as we know, is one of the most common causes of corneal blindness in the world. Surgical methods for the treatment of LSCD have their own limitations and long-term complications. Stem cell therapies give a new hope in this regard. Our study was based on the idea that differentiation of human amniotic epithelial cells into limbal stem cells can be safe and a good option, as it is non-tumorigenic, less immunogenic, and can be applied in bilateral cases. The aim and objectives of our study were to determine the efficacy of isolated human limbal cell functional proteins treated onto amniotic membrane epithelial cells to transdifferentiate in vitro into limbal epithelial cells, and also to demonstrate the ex vivo growth and characterization of allogenic limbal epithelial cells. The study was done in our stem cell research and regenerative medicine lab. The limbal tissue from eyeball of deceased donor and amniotic membrane tissue from placenta following an elective LSCS of a healthier donor were used in our study. The above tissues, which were tested positive for serology, were excluded from our study. As for amniotic membrane cell culture medium, we used Dalbeco's modified Eagle medium, low glucose, 10% fetal bovine serum, and also 1% antibiotic antimycotic solution. For limbal stem cells culture medium, we used the above same DMM medium, coupled with a few growth factors such as insulin, transferrin, selenium, epidermal growth factor, and hydrocortisone. As for exosome isolation, we use polyethylene glycol 6,000 molecular weight, 50% weight by volume, the Dalbeco's phosphate buffer solution, and buffer solution such as HEPS. We did protein estimation by bisynchronic acid method and also used Western blot protein markers. As for immunocytochemistry and antibodies against ABCG2, cytokeratin 12, E-cadherin, vimentin, and GAPDH markers were used. Firstly, we isolated the amniotic membrane epithelial cells. The amniotic membrane was stripped off from the chorion and was subjected to PBS wash to clear out the debris and blood clots, following which enzymatic digestion of the amniotic membrane was done with 0.5% EDTA trypsin solution, following which primary culture of amniotic membrane cells was done onto the culture medium, which is the DMEM medium. Subculturing of amniotic membrane cells were carried out into multiple cell passages until the cells attained a confluency of 60 to 70%. Similarly, we isolated the limbal epithelial cells. A 2 into 2 mm biopsy tissue was taken from the corneoscleral corneoscleral rim and was cut into multiple subsections, which was transferred onto the primary culture medium. Once the sufficient cell passages were attained with a significant confluency, the PEG precipitation of the limbal exosomes were carried out from limbal stem cell medium, and exosomes obtained were tested for purity and protein quantification using nanoparticle tracking analysis and scanning electron microscopy. Post 70 to 80% confluency, the third passage of AME cells were treated with limbal stem cell exosomes at a concentration of 10 microgram per ml concentration. After 48 hours in CO2 incubator at 37 degrees Celsius, the differentiated stem cells were observed for morphology and subjected to Western blotting and immunocytochemistry. Coming to results, we observed the morphology of AME cells at the end of third cell passage and was observed to be spindle-shaped cells. As we can see in the marker is not there. Coming to limbal epithelial cells, similarly we observed cuboidal epithelial cells at the end of third cell passages. Nanoparticle tracking analysis was done to quantify the particle size and was noted to be 150 to 200 nanometer peak concentration and was correlated using scanning electron microscopy. The morphology of tuned AME cells at the end of 60 hours was significantly different from that of the control group, that is the AME cells in the control group, and at the end of 5 days we noted that there will be significant doubling time was noted. Western blotting analysis was done to quantify the protein expression markers, and there was significant expression in ABCG2, E-cadherin, vimentin, and keratin 12. Similarly, on immunocytochemistry, the above limbal epithelial cell markers were significantly expressed. The limbal epithelial-like cells transdifferentiated from tuned amniotic membrane cells are morphologically different from the amniotic membrane cells and has lesser doubling time than the latter. Relative expression of limbal stem cell markers are more in the transdifferentiated cells when compared to AME cells. The amniotic membrane epithelial cells are capable of transdifferentiating into progenitor cells, thereby suggesting an alternative source of stem cells. Also, the exosomes derived from cells of limbal epithelium are efficient in the tuning of amniotic membrane cells. Also, I'd like to conclude by saying that donor eyeballs can also be used as a safe source for the necessary exosomes, and their availability can be put to prompt use. We hope that our study actually opens a new door for further research in this aspect regarding the tuned AME cells and its practical implementation in treating LSCD. Thank you.
Very nice presentation. I just wanted to know what are the markers which you used for the limbal epithelial cells as well as for the amniotic membrane epithelial
So
cells?
we use the markers ABCG2, Mintin, E-cadherin and cytokeratin 12.
Okay.
Also, as for limbal exosomes, the markers are sent. We study for CD9, CD81 and CD63 and a negative marker, but the results are pending for that. We have not
Okay. So the phenotype which you showed was not looking like a corneal epithelial phenotype on your amniotic membrane epithelial cell. They were still spindle shaped. So was there any change in the phenotype, or phenotype remains spindle shape only?
So you mean the tuned time after we use the exosomes?
Yes.
So we cannot certain that they are limbal epithelial cells. They are one thing we certified was that the amniotic membrane cells are capable of transdifferentiating into a progenitor cells. In this aspect, the cells obtained were definitely not spindle shaped, but also we can see at the end of 5 days that cells have become more flattened, more inclining towards a cuboidal shape. So we can only say these are limbal-like cells.
Limbal-like cells.
Not limbal.
Yeah, sure. But very nice